Kick-ass facts, pew pew pew! More outdated medical term. Milk leg, which we now call deep vein thrombosis, specifically in the postpartum period, where a blood clot forms in the leg veins leading to swelling and pain. Milk production was thought to contribute to the swelling of the leg, hence the name milk leg. At the time, there was little understanding of blood clots and other vascular conditions. Swelling and discomfort in the leg were visible symptoms, but the underlying cause, deep vein thrombosis, was not well understood. Medical practitioners often tried to connect symptoms with what was happening in the body, leading to the idea that milk was somehow involved. Softening of the brain, likely referred to encephalomalacia. Brain tissue softening after a stroke or conditions such as dementia, which involve damage or degeneration of brain tissue. It stopped being used because the term was overly simplistic and did not account for the complexity of neurological conditions. Modern terms like vascular dementia or Alzheimer's disease now better reflect the causes of cognitive decline. I mean, it's also just rude. Quinsy, be forewarned, I'm going to butcher some pronunciations. A peritonsillar abscess, a painful collection of pus that forms near the tonsils, usually after a bacterial throat infection like strep throat. The term quinsy was based on historical descriptions and lacked specificity. We now know it's peritonsillar abscess, which refers to the infection and the location, but where did quinsy come from? It originated from the Latin word quinantia, which in turn was derived from the Greek term kinanch. The Greek word literally translates to dog strangulation. Kin meaning dog and anch maybe meaning strangling or choking. The name reflected the symptoms of the condition, which involved severe throat pain, difficulty swallowing, and a sensation of choking or suffocation due to the swelling and obstruction caused by the abscess. Poor dogs, why are they blamed? King's evil. I kind of like that one. Scrofula, a type of tuberculosis that typically affects the lymph nodes in the neck. The term was based upon the belief that a royal touch could cure it. Medieval Europeans believed that monarchs were chosen by God and ruled by divine right. This belief extended to the idea that kings and queens possessed special spiritual powers, including the ability to heal diseases. Modern science replaced these superstitions with the more accurate terms. Brain fever, likely referring to either encephalitis, an inflammation of the brain, or meningitis, an inflammation of the brain's protective membranes, both of which cause fever and neurological symptoms. Other infectious diseases such as typhoid fever, scarlet fever, and malaria could also cause high fevers and delirium, leading to a brain fever diagnosis. The term arose from early theories that linked fevers to disturbances in the brain, especially when the patients exhibited confusion, hallucinations, or seizures. Without knowledge of bacteria, viruses, or the immune system, physicians interpreted these symptoms as the brain becoming overheated or inflamed. The term was too general and didn't differentiate between infections. Chilblains, a medical condition involving the skin's reaction to cold, damp conditions and causes painful inflammation of small blood vessels in the skin. It typically affects areas like the fingers, toes, ears, and nose, and can result in redness, swelling, itching, and sometimes blistering. It comes from the two Old English words, chill, meaning cold, and blain, an Old English term meaning a sore or blister or swelling. In Charles Dickens' novels, chilblains are sometimes described as the plight of the working class during cold winters. The term is still used in some contexts, but it is considered outdated. The term pernio is used more frequently in medical literature, and the condition is better understood in terms of vascular responses to cold.